With the COVID-19 pandemic upon us, the faculty of Columbia University School of Social Work have mobilized the forum COVID-19 Action with the mission of monitoring developments and disseminating information that can be helpful to social workers and the clients that we serve. So today, presenting on social assistance during COVID-19, we are pleased to have our Columbia School of Social Work professors, Rob Hartley and John Robertson, and as well as a guest presenter, Dr. Bradley Hardy, Associate Professor with the Department of Public Administration and Policy from American University in Washington, D.C. So with that, I'm turning over the mic.
Great, thank you so much, Tiffany, and also want to just say thank you to the many people that are organizing this series and helping put all this together. So I really appreciate all of that. So just as a brief overview of what we're going to do today, we're going to be talking about first just a motivation about food security and the pandemic, and then moving into policy responses, and we'll spend a little bit of time focusing on food stamps, the Supplemental Nutrition Assistance Program, SNAP. This is one of the biggest program we have fighting hunger. And so we'll spend a good bit of time there, and then add a little bit more context to the situation that we're in right now in regards to hunger. And then kind of close briefly talking about income supports and the relief checks. So just as a brief motivation from me, and then want to jump right over to John, is that the food insecurity implications of this moment is just alarming. So what you see here is it's a figure put together by Lauren Bauer at the Hamilton Project with the Brookings Institution. And what you see first is a long series of food security measures in the United States. And this is from the USDA's survey instrument in the current population survey. And you can tell that food insecurity, even during the Great Recession, and you can see recessions in the gray bars there, it didn't spike that high relative to the kind of food insecurity that we're seeing right now during this pandemic. And so I think the numbers just jump out at you, the big jumps at the end, that 40% of households with children under 13 reported that their food didn't last and they didn't have enough money to get more. You see the number for all households is 22.7%. And really during these times, families are typically protecting the children from the harmful effects of food insecurity. But you can see here that even for children under 13 themselves reporting not eating enough. And this comes from actually the Hamilton Project's own survey for mothers and young children. But it has jumped to 17% of children under 13. So these are really alarming, troubling numbers. All the more reason to really focus in on what the policy response has been and how communities are responding during this pandemic. And I want to point out too that the effects of this pandemic have not been uniform across the population. I think we heard early on that this is a great equalizer, and it is not. There were health disparities in our country before the pandemic, and they've only been exacerbated for reasons such as structural inequalities, racism, or different neighborhoods and poverty implications, as well as the types of jobs you have. If people have jobs that allow them to work from home versus those who are considered essential workers, then what we're seeing is this plays out with quite a big disparity in racial terms. And so what you see here are people reporting food that didn't last. And I'm also showing this little gray bar with the asterisk referring to 2018 survey, the most recent survey asking a similar question about food not lasting, and you can see the jumps there that have come as a part of this crisis. And as just a way of brief introduction, we're going to focus mostly on food outcomes, but I also just want to point out the food service workers. This is a map of uninsurance rates among those who are actually helping provide the food, and I think it's really important just to consider the harm that they are putting themselves, the potential harm that they are exposing themselves to while keeping America fed. And in particular, just to note the Medicaid non-expansion states have the highest rates. The darker states are the ones with the highest rates of uninsurance among food service workers. So, so that's just a kind of a brief introduction to the context, and before we kind of get into policy, and I think John has more on this.
Hi, so I've been for the last 35 years working in the East End of Bushwick. So I take a look at this from the point of view of the people that are around. And so the first group that I think of is mothers raising kids on their own, or mothers raising kids who've lost their jobs and are trying to dig around and see how to pay the rent and also to keep food out. Some of whom may have had SNAP and some of whom may not. And then there's another huge group, or the undocumented and the asylees. And many of their jobs have disappeared because they work in restaurants, or they work in car services, or they work in other kinds of factory workers. And so they're now left here without any of the normal income and very little access to any sort of support system. And then there's families who have children at home without school lunch and school breakfast. Today we're not talking about mothers who are still working without anyone to look after their kids, but of course that's another issue here. But this is, again, coming back to food, is school lunch and school breakfast. And then I have many years working in seniors and senior centers, all of which have closed. And so people are looking for where their lunches come from. And also there are many seniors in our neighborhood that are simply too afraid to go out and take the risk of infection. So they're completely isolated and homebound. So we're talking about low-income people living and working in America. And because of the long history of white supremacy and racism, disproportionately we're talking about people who don't look like me, but people who are people of color. And there's no way to disconnect the food crisis from the issues of racism and white supremacy in the country. There are, of course, poor white people who are also suffering deeply. And that, I think, if we look more deeply, will be connected with the same forces. But we have to stay here with that. The education, employment discrimination that are forces that have impacted on people of color are definitely relating to the food security system at the moment. So I just want to finish by talking a little bit about the two systems we're going to be talking about today. One is a system which is more or less by right. You apply to the government and receive school lunch, or you receive SNAP, and you have a lot of control over how you do that. The other is a system that's built on donors, and it's driven by the needs of donors, and it's a charity-based system. So we're going to be seeing these two systems as we move through the conversation today. So I turn the floor back to Rob.
Great, thank you, John. So I'm going to transition here by just discussing a little bit of the main policies that affect food in this country. There've been four major policy responses for the COVID-19 crisis, two of which are really affecting food support policy. So the Families First Act was really the response that said how the government would increase the policy response for supporting families. CARES Act came along and actually just provided the appropriations to fund those things. So that's just the connection between the two. And I'll show in just a second the magnitude of some of those appropriations from the CARES Act. So first, let me just point out there will be hyperlinks throughout the presentation, and you'll have these available if you want to go and download the presentation from the site. And I think that Tiffany might remind you where that is at the end. But there will be links throughout, so you can check sources and go and kind of dig further. But there's a really good link for COVID-19 on the Food and Nutrition Service Agency's website. And so I'm going to give an overview of some of the findings that I pulled from there. And largely, again, I'm going to focus on the food stamp program, SNAP, which I'll refer to as SNAP throughout. But you can go in and see additional details on all of these other programs, state by state, and I'll show a little bit more about that as well. So to get a sense of the magnitude of the appropriations, for one, I just want to point out that SNAP will expand naturally because as more people become eligible, they'll start taking up the program, and so spending will increase. These additional appropriations are to fund new measures introduced in response to the crisis. And so these will be above the increase in entitlement spending. And for food stamps and the SNAP program, you can see that it's a 15.8 billion total increase in appropriations. So we'll go into in just a second what that money is targeted toward in addition to normal spending. But for child nutrition programs, it's 8.8 billion, and then another billion between WIC and food distribution programs, respectively. So this graph shows you a little bit of a comparison of how large that magnitude is relative to their typical spending. But I wanted to try to do it in a little bit more detail, where here it is showing SNAP total monthly benefits from 2000 to the present. And what I've done is I've taken information from the COVID impact survey about people's responses of whether they were using SNAP in April, and they've done another survey in May, and they're doing these surveys every 2 weeks. And actually there should be one any day now for the third week of this impact survey. And so from this, I'm providing an estimate of how many people it looks like will be using SNAP. And based on that, this pre-policy response that you might be able to see with the open blue circles is showing how much SNAP would increase just by added participation. But then when you consider the ways that they've brought in and made SNAP more generous during this time, the total numbers end up being 8.6 billion or 9.5 billion in the months of April and May, respectively. And again, you can compare this to the gray bars. The larger gray bar is the Great Recession, and you can see the American Recovery and Reinvestment Act, the ARRA, in 2009. And you can just compare the magnitudes of these policy responses. However, as we'll go into coming up next, I'm going to have my colleague Bradley Hardy join us. We're going to talk about some key differences between the current response and what happened in the Great Recession. And some important implications of that. And I just want to say thank you, Bradley, for joining us. It's so great to have you. And in particular, you have this great Brookings piece about the state of policy and what we need. But I'll turn it over to you to kind of walk us through what SNAP looks like right now.
Yeah, sure. And then just, it's fortunate to be able to be here to discuss this this morning. And so, Rob has control of the slide deck. Hard for me to give up control. Rob will go through. But I would just start off by saying one important difference. If you're thinking about, the Great Recession, for those of you who have that in full memory relative to now, I mean, just, that was so much of a housing and financial markets-based recession. This does hit deeper into the economy. It does hit up the income distribution to some more advantaged families that have not been typically as affected by recessions. That said, there's still a clear racial and ethnic gradient to this. It's going to hit Black and brown communities, for example, far harder. But I just think it's also important, some of those slides that Rob was discussing about the scale of the expense, you have to keep in mind the comparison is think about those expenditures relative to what could be potentially 30% unemployment. So when you think about 30% unemployment, we're talking about a whole range of costs, a whole range of consequences that span not just the lost jobs, but we're thinking about all sorts of social consequences, family instability. There have been reports of increased domestic violence. There's well-documented nutrition gaps like Rob was showing. We have lost education and learning occurring. And so that actually reminds me, while we're on this, and I'm going to get to talking about the SNAP piece, but I will share with the group a link from the Opportunity Insights team that really does document some of the neighborhood inequality that's shaking out as it relates to learning, and how we see very large gaps in online learning activity by the income level of neighborhoods, right? So there's something to keep in mind there. And that's why these initiatives, boosting programs like food assistance and SNAP, are so important. I mean, this is how we try to do something relatively progressive within our fiscal policy system. How do we get liquidity to families that need it? And I think this audience understands that we're talking about households that are living at very, very tight margins. And so when we talk about food assistance, we're talking about something that's close to cash, right? And so at this point, we're allowing for states and for families to basically max out on the benefit. Now, I propose that we should actually go further than that, but this is still an important step. Pandemic EBT, this is trying to get at the real issue that so much of how we deliver social assistance in America occurs through the school system, through the public school system. And now these children can't get to school. They can't get those breakfasts and lunches and things like that. So how do we support those families that aren't able to connect directly with their local public schools? And then finally, this provision in the SNAP program is sort of related to work. We've seen that policymakers have rightly decided that in a period of high unemployment, there's really no good reason to have work requirements within the system when there's just frankly no jobs. But this is part of a larger conversation. Opinions vary here, but you'll get mine this Tuesday morning. There has been a huge emphasis on work, but in a way that at times can be very punitive for folks who are working, but who perhaps are in more unstable work conditions. And so I think the right move here has been to suspend these time limits. That said, I think that there's more to be done. So Rob, I'll advance slide now. Yeah, so, this is an interesting point here. When we're thinking about who's benefiting from the emergency allotment, it's sort of a tale of two parts of the low-income family experience. So I've proposed, along with others, that what we really need to do is take the SNAP benefit and actually increase it anywhere from 15% or more, maybe 20%. Instead, right now, what we have is that, more families are then going to be eligible for this maximum benefit. So it's not increasing what that max is, as I would like and as others would like. That said, it's non-trivial. I think Rob showed you some of those simulations of what that would look like, how that would help families. But it's important to note that you already have a substantial proportion of families that are already maxed out on the benefit as is. So this policy intervention to extend this maximum benefit won't help those poor families because they're already receiving that benefit. But what this bar chart does show you here is that you are going to have families that are basically what we call near poverty. So they are, 100 represents the poverty line. So if you're at 101 to 150, you're near poor. Well, you're still not doing well just because you're on the other side of that line. Well, the emergency allotment would then extend to some of those families as well. They would get that max benefit. So, again, it's a move in the right direction. And certainly there's poor families that are going to receive the emergency allotment as well. But I think the point here is that it's more than we were doing, but in my view, it's not as much as we could do. And so we're talking about families who are trying to do that most basic intervention of providing food sustenance. So, talking about some of the ideas here for where to go, the HEROES Act really does kind of go in this direction, which is to, top off the SNAP benefit by 15%. It does provide for a suspension of time limits. Importantly, it's worth staying here. There are substantial resources provided for state and local governments. Right now, I think it's something on the order of $540 billion in grants to states and tribes. That's something like $1 billion per state. You have another $150 billion that'll be allocated based on the state's size, and then about $50 billion based on the intensity of coronavirus in the local community. And I think everybody in this audience, or many in the audience, are aware that this is going to go to all sorts of nonprofit and social assistance services, educational services. It's going to prevent layoffs for the whole suite of human services that matter for many of the families and children and workers in our local communities. And so I think this is something that gets lost. We do need, paycheck protection. We need protection for individuals and families, for the businesses, but state and local government really does hold this thing together. And so it's a big part of the HEROES Act. We'll see where that goes. But it's an important moment to note that, broadly speaking, we've got to, in my view, think about interventions that continue to provide liquidity for families that are vulnerable. I think in many instances, this vulnerability will reach further up the income distribution into what some of us might think of as the middle class. And so, my own view is that we've got to be flexible here. If we have a recovery taking shape, given the numbers that Rob and John have discussed, the stark nature of the unemployment, it'll be obvious once we're coming back. And I think many of these interventions can be scaled back accordingly. So, I'll stop there. I've been doing some work on thinking about the social safety net response to the coronavirus. The team at Columbia has been and always does and will continue to do much of the great work in this space. And so, you're in great hands. Just kind of a nice opportunity for me to be able to drop in and say hello to you. And then Rob and John, I will go ahead and try to email that link that I was just discussing from the Opportunity Insights team, and perhaps one of you or Tiffany can drop it in the chat.
Great. Thank you so much, Bradley. It is fantastic having you join us, and such really good commentary you bring into this discussion. And also, I don't think you'll be able to stick around. I really appreciate your time being able to jump in here with us, but just a quick thank you now to acknowledge you, since you won't be around for the Q&A.
Yeah, well, thank you for the work you all are doing. This is really informative, and so keep it up. And I'll look forward to keeping in touch on these issues. So thanks a lot.
Great, thanks so much, Bradley.
Okay, guys.
So wow, the context about families that are in deep poverty that just aren't benefiting from this. I mean, the idea of the SNAP program in general is to supplement nutrition. And like Bradley was saying, it can be an assistance type that is like cash, especially for people who the benefit constitutes like the majority or all of their food spending. So in reality, at a time that is this hard, it can be quite important that the families that are in the most need don't just have the same kind of supplemental support that they did before, but just the full support of a food budget that they would need, in addition to all of the other like income and potential health and other hardships that they're experiencing. So what I want to do now is make a transition to focus on what you can know about your state. So I saw a lot of people here were from New York or maybe New Jersey and Connecticut, a lot of people that are kind of regional. But if you want to check the policies for any states, you can use, let's see if I go back. I think the link that you have, well, now I'm going too far back. So I'm sorry, I'll stop scrolling. Here, yeah, this is good. You can use this link to find out what the SNAP waivers are for your state. And not only what the waivers are, but you can see, like for the example of New York State, you can see exactly what your state requested. You can see the rationale for why they needed what they requested, whether they were approved or rejected. And some of this can be quite informative. For example, so Bradley was showing earlier that 40% of people of SNAP recipients are in deep poverty or receiving the maximum benefit already. Most of them may have zero income. The median family that would not receive any support from the emergency allotments would have zero income. So, so thinking about the different options that states have, you can see, oh, I'm sorry, I've lost my train of thought. The point about the 40%, in New York State, it's over 50%. That's where I was wanting to go. So it's over 50% for New York State. And I'm sorry, that's half of the people on SNAP are this deep poverty group that won't benefit from the emergency allotment. And so one thing that you can see when you look at the New York State request for emergency allotments, in the actual request, they state that I know that you're not going to be able to increase it right now, but 50% more, 52% are not going to benefit from this. And so they actually make that claim right in the document. So it can be informative to read what states are asking for and how they're stating their need. And this is for 2 months. So this emergency allotment will cover states for up to 2 months. So I mentioned that some of the states already knew that they could not request to increase the maximum benefit. And that's because there is a whole list of mass denials that the USDA has already said, if you request this, we will say no. And so you can go to this site and pull up a list of what the mass denials are, what they are not allowing. And here's an example where when I first got this information, the pandemic EBT had been requested. So they had received the request, but it ended up being approved later. It is now approved in New York State. So I found that these documents can be really helpful, and you can see that there's more margins for policy response than just the emergency allotments. Many states are doing extended certification periods where they're waiving periodic reporting. So you still have to prove that you're eligible, but you don't have to kind of keep reproving that you're still eligible as frequently during this time period. And so you can go to the site and find lots of other examples of what states are asking for and what they're getting. So this is a not incredibly informative graphic because it's showing every state now has been approved for emergency allotment. So I'm just making that a kind of a strong visual. 100% of the states here are receiving the emergency allotment. But I do want to point out they had to submit a request for it. So this isn't something that the federal government is just doing uniformly and giving all the states all of the provisions that they could. The states have to request it and justify it. But all states have now been approved for emergency allotments. That is bringing every family up to the maximum benefit amount. Not every state has been approved for the pandemic EBT. This is where the children who would get free or reduced meals at school and are not able to go to school, they're now able to get that same amount of money through EBT similar to SNAP. If they're on SNAP, it can just be added to their SNAP EBT. If they're not on SNAP, they can still get pandemic EBT. They would just have to apply and get a new card. So you can see here that the majority of states have, but not every state. So you see clearly labeled the ones that have not been approved. I can't say whether necessarily all of them have not requested, but you can go and check the individual states to see the status of whether they've requested it or not. So I also want to note that the hardship of this time is that not only are people hungry, but to get food, you need to go out to grocery stores oftentimes, and especially what do you do if you're on SNAP and you can't order online or have groceries delivered using your SNAP EBT card? So so the New York Times shared this article about this difficulty, but in fact they do point out that there was a pilot program that was starting up. I believe it was around. I mean, it takes a couple of years for these pilot programs to get going, but I think it was last year. And New York State was actually the first state in the country to implement this pilot program where SNAP recipients could order and have food delivered online using their SNAP EBT. So at the time when the when the New York Times ran the article, this is what the landscape looked like in terms of states that were participating, that are shaded in the darker color, and then states that were in the planning phase. So perhaps they had already submitted a request or were kind of designing their program. Now, I want to point out that since then, and this is true for everything in this presentation, things are moving quickly in this time period. So since then, we now have much broader coverage of states where you can use your SNAP EBT to order online and have it delivered. I believe that you would still have to pay for any related delivery charges or tips not using the EBT, but you can order the food. You can use, generally, there was a longer list of retailers that they initially were targeting when they were thinking about who you could use the service with. But right now, it looks like almost every state is approved for Amazon and Walmart. In the state of New York, you can also use ShopRite. And there's a couple of other states like, what is it, Alabama, you can use Rights Markets. And DC has, DC only includes Amazon. But for most states, it's Amazon and Walmart. So it's good to know that this is an option. And for those states that are now in the planning phase, that option may be coming soon. So there's a hyperlink so you can check back in on that. And by way of kind of transition back to John, and John, you're welcome to come on back up and join me. But I do want to point out, and this is, by the way, this is the same Lauren Bauer that I cited earlier with that great graph that they made for food insecurity. And she was on CNN, and I saw that Hamilton tweeted this, that for every meal that is provided through a food bank, SNAP provides 9 meals. There's a great efficiency to the program that we have, our biggest food assistance program that we spend all this money on. There's a great efficiency to it. But yet, I'll I guess leave it to John to kind of give you more of the framework for how food banks and other distribution options kind of fit in.
Oh, thanks very much, Rob. So we've been talking about the system by right. You establish your eligibility and you receive benefits by right. Those of us who've worked with SNAP for a while know that it often provides 3 weeks of food, and that at the end of the month, the refrigerator is pretty empty and people are looking for food elsewhere. That hasn't changed because the maximum benefits haven't changed, which is what Bradley was talking about. You know, should we be providing food for the whole month? But where I'm going today is to talk more about the voluntary food system. And so there's a federal program, part of the COVID CARES Act, which provides direct support to farmers and ranchers, $6 billion. And then the USDA purchases and distributes an additional $16 billion, an additional $3 billion of produce, dairy, meat products, for food banks, faith-based organizations, and nonprofits. So this is this voluntary system that we have that moves food from donors to recipients. And so we find this food heavily as food waste. So it is food that is on the farm that is food waste. It is food that is, oops, I'm having a little trouble with my slides here. It is food that is given by the warehouse system, so the food transportation system. It's food that's given by local grocery stores and by the large corporate grocery store systems like Walmart or Amazon or anyone else. And then it's food that's given by restaurants. And so all of this food is provided with heavy federal government support, because as you see, they're giving $16 billion to farmers to subsidize this and buying $3 billion worth of food. But that's not really where the major money is. The major money is in the deductions, the tax deductions that are taken at every level of these contributions of food. And so whether it is farmers getting it or tax expenditures to corporations or individuals. And so when we come back to thinking about how we do this as compared to thinking about a system like SNAP, which Rob just pointed out is doing 9 meals for everyone, we want to think critically about where we are with this. So there's a national organization called Feeding America, which has distribution sites spread all around the country. And Feeding America raises money from most major US corporations and collects food, excess food, in another world, food waste to be distributed. And they move it from their regional warehouses to these places where it is provided. And so this is a 2018 slide. And you can see that some of these meals are paid for by SNAP, some of it they buy, that some of it is fresh produce, some of it's federal commodities, and then manufacturing and retail donations. So this is a system of gathering up the excess food and for distribution. And this is a slide from Feeding America of what this year looks like compared to last year. So this goes to the end of April. And by the end of April, we are using 4.5 times more food to be distributed through the food bank system. So we've gone from 6 million pounds a month, or a week, excuse me, to 26 million pounds a week. And so this is an enormous expansion of this food distribution system that is driven by two things. It's driven by the problems of food distribution from food producers and food distributors getting their food to market. I have a great story of a friend of mine in Bismarck, North Dakota, who was called up one morning by a farmer who said, "I'm bringing a semi-trailer full of pigs into town, and anybody who can slaughter one can have one." So this distribution of food that is as the distribution system broke down. And then it's driven by the demand at the local level, at the level of distribution of people that are needing food. In New York City, there are a variety of systems. There is, I'll show you in a minute, our food bank and food pantry and soup kitchen system. There is food help coming through the schools with grab-and-go meals in neighborhood schools, and then increasingly using the pandemic EBT card. HRA has some expedition for signing up for SNAP and cash benefits. This is complicated by the limits of HRA to function at the moment because of shelter at home. And so getting new cases opened can be complicated and can require quite a bit of advocacy. And then there is donated food that the city is putting into the donation system. And then New York City will deliver 3 meals for 3 days to any household that is without food through the New York City Food Assistance Delivery System. So this is a map of, sorry, I'm having a little trouble with my slides here, of the New York City Food Bank distribution system. And so it is mostly food pantries that are spread all through the 5 boroughs. There are some soup kitchens, which are the blue dots. And then there are a few other forms of this. And in last year, they delivered over a billion meals through 1,800 charities. And they returned something over $1 billion of income to the community. And so this is a very, very large system in New York City, the system of food distribution, which is replicated in many cities around the country. And in many rural areas too, there's food pantry provision, although access can become an issue. And then in New York City, we have we've developed a system of restaurant contribution, or the distribution of excess food from restaurants, or the distribution of food waste from restaurants, with City Harvest gathering that all up and moving it has been to senior centers, has been to community centers, and also has been through the pantry and soup kitchen system. So we have this very large system of providing and distributing food, which is involves billions and billions of dollars of money, and is donated. And that means that the system is focused on the donor and not the recipient. And so at the recipient level, this can mean finding out when the food pantry is open, Thursdays from 2 to 4, finding out where it is, and then going and standing in line. And depending on the volunteer staff of the food pantry, it can mean being given a bag of whatever happens to be around. Or in certain food pantries, they actually have the capacity to allow people to kind of shop for what is on their shelves. But this system really has to be contrasted to giving somebody an EBT card, which lets them go into any supermarket 24 hours a day and buy whatever food is on the shelf. And actually, at the moment, federal law allows even the purchase of cooked food during the pandemic. And so these are these two systems, one that is rights-based and the other that is charity-based, one that is recipient-focused and the other that is donor-focused. So then in New York City and in many places, there are neighborhood organizations starting, which are groups of committed neighbors who are coming together to put together resources for their community. And these resources can include recreational, childcare resources, social support resources, visiting for shut-ins, and they also include food. And so I'm working with one in East Bushwick and Ocean Hill that is developing a food box program for shut-in elderly. And this is completely done by the efforts of people in the neighborhood, with a small degree of funding from outside, but mostly is within. And you can check here at Mutual Aid Resources of New York City, or there is a national mutual aid page to find these organizations. Now, in terms of social cohesion and building community, they have a really important role to play. But once again, this is a food system that is structured by the donor and has limited responsiveness to the recipients. So I'm going to stop there, and having talked about the food distribution system, and talk a little bit about where we are with seniors. So I, for many years, have been working in senior centers, and I've run a couple of Meals on Wheels programs over my career. So this is something near and dear to my heart. And the thing about food amongst seniors is it's one issue. And there certainly are seniors for whom the primary issue is getting them food today. They may be shut in, people who wouldn't normally be shut in and are now coming out of their homes, unwilling to come out of their homes because of fear. But even in that situation, when we're delivering food boxes in Ocean Hill, we need to be paying attention to what are the other needs. The needs of social isolation, the needs of routine issues around the the apartment or the home that need to be maintained. And then the issues of aging, the step down issues of confusion or of depression or of some kind of physical disability or some kind of disease process. And so when you're working with seniors and food, you really need on staff social workers that are capable of thinking through and attending to the assessment issues that are going on with seniors. The basic food security system for seniors is Social Security, SSI, and SNAP, and VA pensions and other pensions. And that is not disrupted by this system at all. SSI-based SNAP is still available and hasn't changed. And so in some sense for seniors, nothing significantly has changed, except for the fact that the senior centers have closed. And one of the ways that we provided nutrition to many seniors is by providing them breakfast and lunch at a senior center. And so the question is, how does that get picked up? The federal requirement is that senior centers have to be delivering meals. And so that's an expansion of the Meals on Wheels program. And so there is a meal delivery program. This is spotty because accessing the formal Meals on Wheels system can be complicated, and some of the seniors themselves are not well equipped for making this transition. And some of the senior centers are not do not have the capacity to really follow through on this. So this in our neighborhood and around the city is causing some problems in food distribution. I was told by a group that are working in a Chinese senior center in Flushing that they're not worried about food at all because they got $1,200 from the government in their payment, and they're using that to buy food from grocery stores. So the resourcefulness of seniors themselves in solving this problem, it can't be understated, but the holes in that resourcefulness have to be attended to. And this links to the need for home care, the need for someone to be in the home to support bathing and toileting and cleaning and food preparation, and also people that move to assisted living or to nursing homes. And then there's the real issue, extension of family care. And when family care has been providing quite a lot of this and the family has lost its income, that's a really significant problem. And so this is a system where it is the wholes that matter, and then the attentiveness to the stages of this. And this is interacting with the incredible vulnerability of seniors, and particularly seniors of color, to the virus itself. And what's happening with the healthcare system in that delivery, and what's happening in terms of how the community and the food system and healthcare system can respond to that. So I think I've kind of covered my period, except to go back and talk about Meals on Wheels, which has been in place for many, many years, delivering food to seniors. Sometimes it's a highly professionalized organization with paid staff doing the delivery and food prepared in a central kitchen. In other places, it's much more decentralized with volunteer food delivery and with food prepared in a local site. And so there is an expansion of Meals on Wheels in many forms: cooked meals, food delivery of goods that are happening by communities and by the senior centers through the Older America Act. So I think, Rob, I have covered my territory.
Yeah, and John, you're welcome to stay up with me for this next section and jump in if you want. But so this is kind of a transition moment where we've been focusing a lot on food security, support programs. And now we want to bring in some context about the income support that's available, although this is kind of a smaller part of the presentation. But let me just note too that I've seen a lot of questions coming in on chat, and hopefully people are using the question and answer box. But look forward to getting to those. But glad seeing some coming in. And I think some of the questions are even getting addressed in real time as John was talking there. Thanks, John. Okay, so I think the economic impact payment or the recovery rebate or relief checks, I've heard many names for this check. I think most of us are probably familiar with it, and a lot of these checks have already gone out, but we'll provide a little information on this. The size of the benefit varies depending on your income, as you can see here across the x-axis. Like eventually it phases out, and if you're above what, like depending on your family size, 150 or 200,000, then you're not getting any benefit. But you can see that it's like 1,200 per adult and then 500 per child, and up to a maximum, it looks like, of around, what is that, 34? I have to do quick math with the married. There's 2 adults is 2,400 plus 2 children is, but I don't think it has a max, because we actually have, so we have 3 children, and so we get 1,200 and 500 per kid. Okay, sorry, I shouldn't do math in real time on a webinar, but so this is a visual of what the schedules look like for those. And if you want to have a sense of how people plan to use the money, I thought this was kind of interesting. And one thing I'll point out is that one of the questions I saw, and I'm not sure about the name pronunciation, is it Aline? I was asking about people who might be undocumented or not expecting support. But I'm just interested in this figure for families that have less than $36,000. Who are the ones that do not expect payment? Because that's 9%. I mean, that's almost 1 out of 10 in this group that are saying in this Gallup poll that they do not expect. I mean, that's what you would think for families of 90,000 or more, higher income families, that, you know, about 1/4 of those higher income families don't expect the check, and probably because they think that they're in that phase out region. So around 1 in 10 of households are not expecting payment. So some of that might be that they don't think that they have eligibility, and some of it may have to do with figuring out how to actually get the payment. But John was sharing that story about folks who are planning on using the check expressly for food. And so you see a lot of people are, especially in the lower income category, 44% are paying bills. Probably a lot of that's rent, essentials like food and gas. So a lot of those food payments you'd see in that 26% on average for people responding. Although obviously some people might really have the need for spending all of it toward food. Not so much on non-essential items or saving, although that's what you see more of for the higher income families. I don't want to comment too much on the size of people with 90,000 or more that are donating to charity. It's 3%. It's the same number if you look at families that are between 36,000 and 90,000. I'll just say that I found that a little bit surprising, that a lot of the spending for higher income families seems to be going toward saving or, you know, I guess largely saving, and a larger probability of spending it on non-essentials. So for those people that haven't gotten their money and aren't sure about how to get it, I would first go to the Economic Impact Payments website. You have the URL here. And if you were a filer this year or last year, so I haven't filed my taxes this year yet. And I went and tried out the system. I tried out the system, and I actually have a record. I tried it out on May 6th, May 7th, May 10th, May 11th, and I was successful on the 11th. I don't know what that says about me or the system, but and I was reading people having trouble with using different internet browsers and formatting your address correctly. I moved since the last time I filed, and that was a complication. So they actually have my updated address. I didn't know that. I thought they might have my old address. But so I'll just say that it took me a few tries. And then when I was successful on the 11th, they said, and this was going to be for, I gave them my banking information. and was expecting that it would be immediate, but then it was, I think 9 days later, I ended up actually getting it in my bank account on the 20th. So, so here's the portal where you might go. You will need to know things like if you filed before, what your last adjusted gross income was when you filed. You'll need to have your banking account number and routing number ready to go. You also, so in addition to your adjusted gross income, you would need to know your refund or the amount that you owed last time. So you need to know that number as well, that rounded number. And then you can have it, you can give them your banking information and have it direct. If you were a non-filer, there's a process for that as well. So if you are checking on that or helping someone with that, maybe that is useful information. So up to 200 million Americans will receive a payment. That's what they're expecting. The IRS will be mailing out approximately 5 million checks per week. And so this could take actually up to 6 months. In some of my reading about this, I heard that the Treasury Department may have disputed that it would take that long. And so, you can make your own estimate. But I believe there's links here for the Ways and Means Committee from the House of Representatives. And I believe the 5 million per week was actually their number. But anyway, there's links here, and you can kind of estimate on your own judgment. But they are supposedly prioritizing, or they say they're prioritizing lower income families, so they should be getting the checks the soonest. So on this next slide in particular, this is where I was hoping that John might want to jump back in with some more context. But first, I'll just kind of describe it. So this is again from the COVID impact survey, and oh no, I clicked. I didn't mean to click. Okay, so what you're seeing is in the bar charts, the bottom blue, that bottom bar is people who have received these different sources of income. So you can see that people are receiving, 6% are receiving unemployment insurance, but actually more of the people that are receiving it are either applying for it or trying to apply for it and haven't received it yet, according to the survey. So for unemployment insurance, you see 6% have received it, an additional 7% have applied for it, and another 7% have said that they tried to apply for it and apparently were unsuccessful. The SNAP numbers, and these are actually the participation numbers that I was using for my projections earlier about the monthly spending. But this is showing that, by the way, there's 2 weeks of the survey that are out there, and these results are combining those 2 weeks. But you can look at the 2 weeks separately and see how this is kind of changing over time. But 13% of households are receiving SNAP. Another 4% have tried, and another 4% have actually applied. So, so this is where I would say that okay, we've got nothing has really changed for TANF. I think part of Bradley's recommendations were that TANF should have been expanded as well, along with Jim Ziliak. We also have supplemental security income not changing, I believe. And then there's other government support. How many people are going to food pantries? And then community assistance combines a few different things as far as like religious communities or neighborhood organizations or perhaps unions. So those are all combined under community assistance. So John, did you want to like just add any additional?
Yeah, well, there was a whole session on UI in this series, but
right.
It is pretty amazing in many ways, the $600 a week UI payment. And that probably has had the largest single effect on poor working families, that when they've lost their job, many people are actually getting a larger paycheck than they would have before. That's not a bad thing in a time when people are coping with so many confusing and complicated things. And the thing also, I think this section about the number of people who have tried to apply and been frustrated, the number of people who are waiting. The UI system is completely overwhelmed. It's state-based, and so although it seems like a solution that is working pretty well, it has a lot of problems in establishing the UI, your right to the benefits. And so that's something worth paying attention to. It's worth working for. We've talked a lot about SNAP here and the expansion of that. TANF is stable and is relatively unimportant anyway. It's a very small group of very, very poor families that are receiving TANF. We've been dismantling it for years, and we've gone a long way towards dismantling this support for poor children and their parents. SSI, someone in the Q&A just asked about this. The disability categories don't change in any of the COVID characters. So the only people who would be applying for SSI that weren't eligible before the pandemic would be people who've lost their jobs but have a disability. And that is this complicated application process that takes a year to 3 years to complete. And so while SSI is very important to provide stable income and the SNAP that goes with it for families with disability and for seniors, it's not going to have a great deal of response here. Other government programs, and I'm assuming here that some of the larger are the earned income tax credit, which actually people are losing as they lose their jobs. And so if they're covered by UI and they get their UI, they're probably getting it back. But this can mean a substantial hit for someone that's working at a very low wage and loses their job. And not only do they lose their job, but they lose their wage supplement through the EITC. The child tax credit has, the refundable child tax credit has been expanded and is available to really almost everyone now. And it is available to be paid monthly. Most people are used to getting it back with their income tax in the beginning of the year, but it can be paid in a monthly check. And so when you're working with a family that has children and is struggling, getting their refundable child tax credit monthly can really be a big help. And then there's the whole world of housing assistance, which is vital for many, many of our people, both mortgage assistance and so federally insured mortgages can be deferred. If they're not federally insured, you're kind of at the discretion of the banks. And then in the rental world, there is, I'll put it in chat, a URL for the National Low Income Housing Association, which does some inventorying of all of the rental assistance programs around the country that are being set up by local and state governments. In New York City, there's HRA has a rental assistance page. And I'm aware of several people now that have gotten either one-time grants or are moving towards getting FEPS grants in the middle of this pandemic. And so although that's not directly related to food, it's related to household security. And if the rent's not paid, the food is in trouble. So, and then in New York City, we've stopped evictions. In New York City and New York State, we've stopped evictions. And so the final thing is that I just really want to show here that 13% of people are using SNAP and 9% of people are using food pantries. And so this discretionary donor-based system is a huge provider of food security in our neighborhoods and in our communities. I'm kind of closing on probably the theme that I am most motivated by this, which is the difference between right and charity, and how we think about social welfare in general, and how this plays into the disproportionality of disadvantage that we're seeing, the racial and ethnic disproportionality by removing the right to food and shifting it to a discretionary charity. It makes a significant difference and reinforces a system of white supremacy. But the country is on balance, many people in the country are trying to respond to this. And there has been in Washington and in state capitals some real efforts. But the underlying struggles that we're having about how we provide security to people in need are very much part of the struggle about the CARES Act as it's being debated in Washington, and how we expand SNAP, and for how long and for who. So with that, those are final thoughts from me. Final thoughts from you, Rob?
Thank you, John. No, I really like having you kind of sum up the session for us. And so I think the transition now is that we will have some time for questions, and I've already seen some really good questions that we can discuss. And I'm just going to note that there's also an appendix to these slides. And so if you get the materials later, you can go and see kind of some other resources that are available. But no, thank you, John. Great, that's a great wrap up. And perhaps Tiffany, are you going to join us back for the question and response time?
Yes, we have a number of open questions in the Q&A box. So we'll go ahead and get started. And just a reminder for everybody that the presentation slides will be made available via the COVID-19 Action website. And we'll get that link posted in the chat box shortly here. Okay, so I'm going to go with some of the questions that also do go back to earlier in the presentation. I'll start there. We do have someone who was questioning and wondering how current fiscal policy will have an impact on the SNAP expansion, and if Congress is thinking about this. Are they going to make the SNAP application and eligibility process easier so that people can actually get them when needed, and not later or after things have been exacerbated more? So wondering about you guys' insights and thoughts on that.
So I don't know if John has any kind of insights on where things are moving. I know that the HEROES Act was pushing for a lot of the things that Bradley and many other policy advocates and academics have been arguing for the SNAP program. So, which would be to increase the maximum benefit and also kind of, I think this was mentioned earlier by Bradley, like there's this growing restrictiveness to the SNAP program in general. And so part of this policy response has actually been putting a stop to some of the things that had been approved or were coming down the lane in terms of making it more difficult to participate with the SNAP program. And in fact, there was a district court final ruling that basically put a stop to any new restrictions at the time. But in general, the main theme of this first round of SNAP policy seems to have been, these are adjustments that are temporary. The policy is designed in such a way that they will not just become part of the SNAP program. And so we do need another round of policy, of reform to support families going forward, because I think the measures didn't do enough. They weren't targeted well enough. Yeah, so I think that there's a need there, but I'm not sure, but beyond the recent HEROES Act draft in the House, if there's any other kind of new policy movement on that.
Well, we're looking at the CARES Act, which brings us back to the long-term debate about this, with the House taking one position and the Senate taking another position. And this is directly relates to many things, but it relates to what's happening with SNAP. And so the center of the policy debate hasn't shifted. But I do want to pick up one other thing, and that's that SNAP eligibility is largely controlled by state and local government. And the application process, how complex it is, how rigorous it is, and how available it is, that's in New York City is controlled by HRA and not by federal law. And I'm not seeing significant move there with HRA to make this a more open process.
And just like one note on, I was going to mention this earlier, but I think John kind of hit it, but I want to reemphasize SNAP and EITC have become major work supports for a large portion of the population and these are programs that are lifting working families out of poverty. So there's a lot of people who are working and struggling, maybe multiple jobs, and these are really critical programs that have really transformed into work supports, not something that you might have thought of as welfare programs like 30 years ago. These are kind of essential work support programs now. And I think that this is essential that we do this well for the population that depends on that going forward.
And the child tax credit, the three units together create more income often than the paycheck does. So go ahead, Tiff.
Thank you. So we have another attendee also asking, do you anticipate food shortages to dramatically increase in the country with food plant workers out sick or dying from COVID? Many patients are incredibly fearful of the situation. And then also too, I'm just going to that question also add in an additional question that was saying, what do you think that the government can do to ensure that food assistance and living assistance can be distributed more evenly?
Well, I would call those two questions, right?
Yeah.
I could say something briefly about the first question, and let me just show an example of what's in the appendix here. The Food and Nutrition Service has great question and answers. Our Center on Poverty and Social Policy has done a lot of work about restrictiveness of SNAP and how it affects poverty status. But I wanted to get to this. The expectation from USDA and kind of the policy experts and planners is that food prices won't be soaring. That's their expectation going forward. And so I think that kind of speaks to the idea of, is it going to be difficult getting food in the future? I think certainly the issue about meat has been prominent, partly because it's because of the health implications for people working in those factories, and the idea that the government might come in and mandate that they stay open. But in terms of food prices in general, and if you actually go to this link, you can see their outlook for specific categories of food prices. I think that, for example, egg prices might be expected to see more of a rise than some others, but it's not a large rise compared to typical inflation. So that's a little bit of evidence that I could share on that topic without having much more expertise about food distribution systems. John, did you want to take?
I would like to link the two questions just a little bit. You know, the U.S. has this vast overproduction of food, and we've had overproduction of food for several generations now, and so our food system is very robust, and that's why we're talking about all of this food waste. Food waste doesn't just happen during COVID. It happens, you know, there's some estimate that 40% of all food produced in America is wasted. And so that's the creation of the SNAP program during the Second World War, and then again in the early 60s, was precisely built to create demand amongst low-income people to access the food so that the food system could be fully used. And it was intended to give people the right to access to food. And so we're in a debate about whether or not people have the right to food. And there's a push from on one side to say this is creating dependency, we need to move to self-sufficiency. And then there's a push from the other side saying, really, food is we're thinking of food as an issue of dependency and not just as a basic substance of living. And so I think that when you ask the question about are we moving to a system that is going to be more equal in the distribution of food, the fact is we'd be moving in the other direction, and into a system that is less equal in the distribution of food by limiting SNAP. And some people have been saying that the pandemic is going to be a time when America makes decisions about the future of its direction in many ways, including its social policy. And so for those of us who are social workers, it's a good reason to be engaging as fully as we can in the policy formation process.
All right, thank you. Let me see here. And another question is going to be going back to the mutual aid slides that you guys touched on. And the question is like, are these programs, these various mutual aid programs, only available during COVID, or did they evolve out of this situation, or will they be programs that have continued or have previously been in place? We had a couple people wondering that one.
Well, these are very specifically neighborhood structured programs. So there's really a need to find out about the specific area where you are and what's happening with mutual aid. So I'm in Bushwick, and the Bushwick Mutual Aid Group has been around for 5 or 6 years and has been actively doing things. They've scaled up now, but they will not disappear at the end of the crisis. The Ocean Hill one that I spoke about is developing during COVID and is thinking about how to have a life beyond COVID. There is a certain sense where mutual aid and gentrification are linked. And so the people that are coming and building mutual aid societies often, mutual aid efforts often are the new population in neighborhoods, and their linkages to the traditional population, it needs to be built. And so there's issues there too. So I think that it's worth, if you're working in a community, to explore and see what's happening, and also to become one of the people that's active in imagining and shaping where mutual aid goes in your community.
All right, and then also too, how do they determine what food is wasted that the farmer provides for the programs? This is going to be going back to what was spoken to earlier in the presentation. Is there anyone investigating the safety of the food? And if not, is it possible that the food afforded through this program is a contributing factor to chronic illness plaguing the communities that rely upon them for food security? We had a couple of folks who were wondering about that.
Well, I would say about that all of this is pretty rigorously FDA supervised, and the Feeding America follows all FDA rules. The New York City Food Bank follows all FDA rules, and so there's a great deal of attention paid to keeping the quality of the food in compliance with the FDA rules, just as in any grocery store, including expiration dates and so forth. Those of us who remember the old commodities program, however, will remember that it was a program of processed foods given by manufacturers, and there's still some of that. And then you would want to ask questions about the nature of the processed foods and the amount of sugar added to the processed foods and the amount of trans fats in the processed foods. So if you're getting food in boxes and cans, you would want to be attending to the structure of that food. But overall, it's meeting FDA standards.
All right, thank you, John. Moving on to a couple questions here regarding the stimulus check. If a person receives SSI, do they qualify for the stimulus check? And then a follow-up question with that is going to be also, will another check be issued?
So my understanding is that the folks who are receiving SSI, if they didn't file tax returns, would actually get their benefits automatically through their SSI. And will there be another check? I think there was so by the way, I'll just note that I'm an economist that teaches economics in a school of social work, which I love. And I always take the opportunity to thank social workers for the work that you do, because I just think it's amazing. But I say that to bring in the fact that there was a open letter of economists asking basically, these are the responses that we think that the government should be taking. And I think that most economists would be clear that we need some sort of ongoing support. So I think that there's a need. I'm not sure what that might look like. There's a lot of uncertainty probably going into elections in the fall. And so I mean, the biggest thing I have to base expectations on is what the House has asked for with the HEROES Act, and kind of hearing some reactions that in some ways that was too bold of an ask, but I'm not actually providing any commentary on whether it was too bold or not. But I'm hopeful that there will be more rounds of support. I think it's needed.
The question is should this be a universal benefit that is given to people who are fairly high income? Or should this money be put into the SNAP program and put into the housing program and be put into the Medicaid and healthcare program so that the benefits are more focused? And social workers traditionally have argued for universal programs because we believe that they get political support and they have longer life. And when we have targeted benefits, people decide that the poor are just getting over and they start wanting to cut them. But there's going to be a debate about if we're going to spend a lot more money, are we going to target it or not?
Yeah.
Okay, thank you. Another question we received is there going to be consideration regarding expanding any services for the undocumented, especially SNAP, or do they need to rely on donor services?
Could you imagine in this administration an expansion of services to undocumented people? So you might see some state level expansions and some, but it's not going to be, it's going to be state level programs that don't spend any federal dollars. Sorry, Rob, I think I interrupted you, but.
Oh, no, I wasn't, but I would. I was just going to go back to the food security estimates and looking at the previous rates of food insecurity and in 2018 and the most recent estimates of food insecurity in April and May of this year during the pandemic. So Hispanic families started off with lower food insecurity and are now one of the highest in terms of food insecurity. And notably, there's a huge shift for Asian families. And so I'm really curious about this result. I know that there has been some targeted racism that is related to, I think, wording about how we describe and how we blame and use kind of pejorative connotations towards China related to the outbreak. So I don't know if that's part of what's driving these rates of food insecurity. Is it a sense of like isolation or non-participation? But I think that's an important question during this time. I don't really know what the mechanisms are, but that's a really alarming increase for Asian families. And I think there was another question in there that I was going to say comment to. What did I miss something, John, that or Tiffany?
I'm not catching it if you did.
Well, actually, if I may, I saw something just pop up on the questions here, and maybe this is where a question that Tiffany might be going to next, but maybe it's a quick one. Where is it advertised that you can buy food online using an EBT card at Walmart, Amazon, or ShopRite? And for that question, let me just kind of, well, this isn't, let me see if I can click here. Okay. I would go to this website here. So it's the Food Nutrition Services USDA site for the online purchasing pilot. And I think that they have Q&As there where you may be able to get more information. But I don't have any experience trying to figure it out from the websites of those stores firsthand. But you may find some more information at that website. Oh, someone is saying it's on the NYC HRA site. So, so that's really helpful for New York. Great. And someone else is saying on Amazon, oh, I just lost it in the chat, but Amazon. You can use EBT for Amazon Fresh. So I appreciate these chats coming in. It's useful. So we're probably near the end here. Tiffany, did you have maybe a last question, or is there
Yes, let me see, look through here, because we do have we're getting through as many questions as we can, but we also have some that we won't be able to get to, unfortunately. I think this is also going to be a really important one too here. What about those seniors who don't have access to the internet, food shopping, and delivery and live alone? How can we help them get access to the food they need?
Yeah, well, that's a major focus of the mutual aid societies. I think that that's going to have to be done at at neighborhood level, so that if you can identify a senior, you can probably figure out how to, either through the emergency food distribution, through a senior centers food distribution, through Meals on Wheels, or through neighborhood mutual aid and food pantry stuff, to figure out how to get food. But the question is the identifying, and then also the issue of who's going to deliver it. And so, you know, where I live, almost no one has a smartphone. People are using landlines and flip phones, so the internet's irrelevant for the seniors in the community in which I work. And so the communication has to happen through networks and through building relationships in communities, and through religious organizations and other kinds of networks.
And I believe I saw in the chat someone mentioned calling 311, and I'm guessing that that's related to this website as well. But I think that they can access the same resources that this website refers to by dialing 311, and I appreciate the person who put that into the chat.
And our experience is that if you dial the 311 number, you're sent to the emergency food distribution system that gives you 3 days of food. And then somebody has to figure out what happens after that. And that requires social workers and community people to have some investment in what's going on.
All right, well, Rob and John, thank you so much for this informative presentation and information. Thank you guys for everyone who has joined in. We had a total, we had over 300 people present today. We really appreciated all the comments, the sharing of information and resources across both the audience and the presenters. The presentation slides will be posted to the website. Promise we're going to be getting those up, if not today, within the next day or two. And then for everybody who is here for continuing education credits, the evaluations and certificate link will be emailed out to those who met the CE requirements within 2 to 5 business days. All right, so thank you guys. Everybody stay safe. Please keep an eye out on our upcoming COVID-19 action trainings. We have been thrilled to be able to just provide these resources and continue, and we'll be doing so moving forward.
Thanks, Tiffany. Thanks, John.
Yeah, thanks, Rob. And it's great to have you all here. And I'm around, I can hang out for a little bit. I don't know if that works, but.
Yeah, so Tiffany, just in terms of finalizing, does the recording stop now? And I think that John and I both might be able to stick around for a few moments if people did have any follow-up. So
we can actually, well, we can keep the recording going, or we can stop it either ways. I feel like if you guys are going to answer a couple more questions, we can go ahead and still keep the recording going. If you guys want to answer any other questions that stand out to you in the Q&A box. We still have about 230 people on.
Okay.
Well, I would take the question about whether the $600 is keeping people from going back to work. No doubt that you can find somebody to put a microphone in front of who will say exactly that. But the $600 is for a very short period of time. And if you're really thinking about supporting your family, you're going to be thinking about where does the job come from that's going to support them in the longer run. And so the people that I know would return to work, even if it did in the short run cost them a few $100s to maintain their job in the long run. So I think this is, it comes every day in the Wall Street Journal, which I read every day. And it just, from my point of view, it's an argument, it's the same argument as the argument against the minimum wage. It just sounds the same to me.
And I was just going to comment, I saw, is it Juan Carlos, the income support is only up to age 16. What happens to the 17 and 18-year-olds who are still in high school? And actually, one of my colleagues, so I have a few, back to this slide, there's the Center on Budget and Policy Priorities. They have a really good basics. They put out really good analysis, but also general overviews. But then our Center on Poverty and Social Policy has a few policy briefs that are coming out now, maybe even today. And one of them has to do with people that are being missed by support during this time. And some of it is for young adults, some of whom are coming home from college, and they're just kind of dropping out. They may be still listed as a dependent, but they're not included for the benefit checks. And in fact, they may be parts of families that have other young children in the home. And so you can imagine that those resources are going out to more people, and even they're being spread out among more people, even though there's not more resources to match. And that's work by Megan Curran that should be coming out maybe today or this week. So so we have been looking, like our Poverty Center here at Columbia has been looking at some of the poverty impacts of the policy response and who's missing out, which is a good question. And also not just young adults, as you were mentioning, but also let's see, dependents who may be older or disabled or requiring care at home, and then of course the undocumented population, and even those that may be documented legal citizens or have other permanent status may be missing out because of mixed households or for kind of fear of attention and monitoring.
I think this question's been answered, but just let me say again that my experience is I've stood at the door of seniors who are either on SSI and Social Security and entered their date of birth and their Social Security number, and they tell me what date their check will be put in their bank account or mailed to them. And so if you've got seniors that are using either of those benefits, they should be seeing their checks, whether or not they file taxes. If you have seniors who don't qualify for either of those benefits and haven't filed taxes, I would be talking to a tax organization that does this, because it will get a little bit more complicated to suddenly appear in the system and where you have not been before. And most of us, the seniors in the neighborhoods where I am, have already received their $1,200 either directly in their bank accounts or by check. So in my experience, we're far along in this distribution of money.
I think so. Well, I think that kind of covers what I see out there. I really appreciate all of the questions and comments. John, was there anything else, do you think, John?
No, it's been really interesting. I've learned a lot through this whole process, and so that's always useful. And I hope we've helped open some doors for you all. So thanks very much, Tiffany and Rob, and everybody else that's been working on this team.
All right, thank you guys.
Thanks again.
And thank you also to Caitlin, who was providing some tech support and assisting people throughout the chat.
Thank you, Caitlin.
Yeah, thank you, Caitlin.
All right, everybody have a good day. Thank you.